Hi, I'm Dr. Strubbe. I'm a chiropractic physician in Pinellas Park, Florida. We're going to spend a moment or two and go over disc problems and a bit of disc anatomy as well. Most people are aware of the fact that they have discs. Not everybody is 100% sure how many and where and what their purpose is. Discs serve a couple of purposes, and we have a disc in between every vertebrae with the exception of the very top two vertebrae, but everywhere else you've got a disc. And those discs help to act as cushions in between the vertebrae. They also help to act as spacers in between the vertebrae. And those are very important functions. The discs are generally pretty durable, but they can be damaged. And what I'd like to do is show you on the skeleton here a little bit of how the anatomy works and what types of things happen with certain kinds of disc problems. The spinal cord, if this were a live person, would be in here where that metal rod is. I'm not sure if you're able to see that well, but there's a metal rod in there, and that's where the spinal cord would be. The spinal cord is really a bunch of nerves traveling together, and at every level those nerves branch out. So you would have a nerve coming out here, all up and down the spine. That happens, and those nerves go wherever they go. In this area they swing across the pelvis and down into the leg. In the neck they would swing across the shoulders and down into the arms. So this is a disc. It's in between these two vertebrae. If you could take that disc and pull it out and look at it from up above, it should be circular or somewhat circular. The outside edge of that disc, the part you can see, is very tough and fibrous. If you had a tiny little radial tire and you stuck it in there, that's kind of what you get on the outside edge of the disc. Very tough, very fibrous. However, the interior of the disc is soft and mushy. That's what makes it a good shock absorber. So if there is any damage to this outside edge, that soft mushy stuff inside, because there's always pressure on the disc, it can cause the disc to begin to bulge. And that's what happens with disc bulges and disc herniations. And essentially a disc herniation is simply a bigger bulge. So I want to thank you for your time, and I want you to have a good day.